Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We are discussing Annavasotas Vyadhi and I have discussed with you about Trishna and Aruchi. I am deliberately taking these small topics in our discussion because patients with these symptoms we always come across our in our practice, and hence to diagnose them as a symptom or disease and to get the proper treatment is very essential. So I am deliberately, you may find that my speed is slow and I am taking small topics, but in this continuation only we will take the Annavasotas Valley, and then we will go to the bigger diseases like Udara, etc. etc. But these all small topics are really important in our practice, and hence I am giving much more time to this topic like Trishna, Aruchi, etc. Now, today's topic we will discuss another symptom which we come across, and sometimes it is tricky to deal with also, is Mukhapak. In the Mukhabag, you always know there is no rocket science. The clinical diagnosis is very easy. Patient himself tells that I have ulcers and I am not, uh, I am finding it very difficult to eat. Even water is also making irritation. Spicy food also makes irritation as it's a normal symptom. So, Mukhabag, you can see that all the ulcers in the mouth, there may be number of way may vary, but patient comes with these symptoms and it is making difficult to eat. The patient wants the relief as early as possible. I have seen the patients which have got mukhabak with 7 years, 8 years. Monthly they have to take medicine on and off, but the symptom is persisting and not getting cured completely, and such patients are cured by Ayurveda completely without any mukhapath in the further life. So, how to deal with this mukhapath? Firstly, always remember when the patient comes to you with the mukhapath, the history and duration of the mukhapath is very important, because it is directly related with the digestive system. So when patient complains about the recurrent mukhapath or frequent mukhapath, always think of the some other major disease in the Annavasotas, and particularly you will find the Grahani is the disease, or Agnimandya is the main problem, and which is because of which the mukhapath is frequently seen. Always remember, longer duration of mukhapath, frequency, increase in the frequency of the sorry, frequent mukhapath in just 15 days in monthly. Just think of the Agni first, and that too Grahani as a disease. You have to evaluate the patient, ask the symptoms of Agnimandya as well as Grahani. You may, in about almost 95% cases, when such histories of Mukhabak is there, you have to treat the Grahani or Agni first. So, when I have seen the patients with 8 years of Mukhabak history, off and on, in all these patients, the Grahani Valley is treated first, and then I have seen the results that Mukhapak is also cured. So, in such patients, two things, as I said, Grahani or Agnimandya symptoms, and secondly, the Hetu in the Ahar Vihar which are contributing to the Grahani or Agnimandya disease. In that case, only treatment of Grahani or Agnimandya is not indicated, is not sufficient, sorry, but unless and until Hetu Parivarjan, like Viruddhahar, Mithyahar, late night sleeping, etc., are also major contribution to create the original disease. So counsel the patient about the Pathya first. This is the first aspect. Second aspect is Paka, Mukha Paka. So it is a Pittaja Vyadhi. So patient, many a times patient have Pitta Prakriti, or they have Amlapitta history, or in their lifestyle spicy food, Atapa Sevan, Jagran, all these Pitta Vardhak hetu are seen. So treating the Mukhapat, along with the treatment of Mukhapat, you have to again make hetu parivarjan of this Pittakara hetu in their lifestyle. So in Mukhapat as a treatment of Agnivardhan, you can get in case of Grani like Takra Prayog, Sutshekar, Kumarya, so whatever we will take detail in Grani disease. Local application, all of you know, mud, honey, Gruta, Gairik, Shankachira are commonly used. Jatari Jal is also one of the good medicine. Many a times you will find that Mukhapat, always examine the patient in detail when patient is complained of Mukhapat. Why? If you find that there are many ulcers spotted at different times, you can think of the unknown and give proper treatment for that. Many a times you will find patient is complaining of the Mukhapat or the ulcer is there, but it is at the specific place. In that patients, he also says that there is no any gastric complaint, there is good digestion, good malapravritti and nothing else, but there is ulcer. Always think of local cause, and many a times some denture problem, that there is friction of the tooth with the tongue, and that friction is responsible for that ulcer. So you have to examine by your finger, by putting the gloves, that if there is some any tooth head is there is some spike on the tooth, and that spike is any filing the it is friction in the tongue. In that case, the filing of the tooth is needed, and only application of any medicine will not be helpful, because hetu is the growth of the peak of the teeth. Another patient where there is no gastric problem, but Mukhabak is there, and it is the side effect of the medicines. Mainly when there is some oncomedicine is going on, you will find this Mukhabak as a common symptom. So in that case, local application is important, and Pitta Shamak Chikitsa like Gairik, Shankhavasma, Ushir, Chandan, etc. are also recommended, because of the medicines there is Pitta Prakop and there are ulcers. So first local hetu, secondly hetu of Grani or Agnimandya, thirdly hetu of Pitta Prakop and or Pitta Vyadhi. These are the three main steps you have to consider, and fourth one is side effect of some drug. So these are the and this is the evaluation of the Mukhabak when you are treating patient with that complaint. In all these things, when there is Grani or Agnimandya or Pitta Vyadhi, viration or Mrudu viration is always helpful. By modern science, there is a vitamin B deficiency is a cause, and folic acid is given. So also ask about the food, whether patient is getting proper nutrition or not. If patient is not getting proper nutrition, you have to add that ahar to complete the deficiency. So this is about the Mukhabak. We will come with the next topic on the next Friday. Thank you very much.